This is PediaCast CME.
Welcome to PediaCast CME, a pediatric podcast for providers. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast CME. It is a continuing medical education podcast for healthcare providers. This is Dr. Mike coming to you from Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 77 for June 30th, 2022. We're calling this one Complex Communication Needs. I want to welcome all of you to the program. So we have another important topic for you this week as we consider complex communication needs. And we will define the term, what exactly do those words mean? And we will explore the challenges faced by patients and families whose lives are impacted by barriers to natural communication. We'll consider the medical conditions that lead to complex communication needs and uncover the role that speech-language pathologists play in helping patients and families overcome obstacles. In the process, we're going to describe the very important role that augmentative and alternative communication devices play in supporting patients, families, friends, schools, and clinicians as we communicate with kids and teens challenged by complex communication needs. So lots of ground to cover, and all of it important for pediatric providers as we support and guide our patients and families. To help us explore complex communication needs, we have two wonderful speech-language pathologists from Nationwide Children's Hospital joining us today, Dr. Jamie Boster and Bridgett Collins. They will be here shortly. But first, let's run through our usual quick reminders. Don't forget you can find us wherever podcasts are found, so there may be an easier way for you to subscribe and listen to the show. We're in Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. That includes Good Pods, by the way. And again, if you like what you hear, please remember to subscribe to the show so you don't miss an episode. Also, please consider leaving a review wherever you listen to podcasts so that others who come along looking for free continuing medical education credit will know what to expect. And speaking of that credit, it is easy to claim yours. Simply listen to the podcast, which you are about to do, and then head over to the show notes for this episode at PediaCastCME.org. You'll find a link to the post-test in the show notes. Follow that link to Cloud CME. Take and pass the post-test, and the Category 1 credit is yours. So pretty easy. And we do offer credit to many pediatric professionals, not only doctors, but also nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by all of these professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of this episode matches your scope of practice. Complete details are available at PediaCastCME.org. We also have a contact link over at that website if you would like to suggest a future topic for the program. And then I do want to remind you the information presented in every episode of PediaCast CME is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. Also, your use of this audio program is subject to the PediaCast CME Terms of Use Agreement, which you can find at PediaCastCME.org. So let's take a quick break. We'll get Jamie and Bridgett settled into the studio, and then we will be back to talk about complex communication needs. It's coming up right after this. Dr. Jamie Boster and Bridgett Collins are speech-language pathologists at Nationwide Children's Hospital. They have a passion for helping kids communicate effectively, and this work is particularly rewarding when kids and families with complex communication needs are provided tools and training to express themselves through augmentative and alternative communication devices. What health conditions result in complex communication needs? What challenges do these kids and teens face? And what exactly are augmentative and alternative communication devices? And how do they help? We'll explore answers to these questions and more. But first, a warm PediaCast welcome to our guests, Dr. Jamie Boster and Bridgett Collins. Thank you so much for stopping by today.
Thanks for having us.
Absolutely.
Yeah, I really appreciate you guys taking time out of your busy schedules to join us. Let's start with you, Jamie. What exactly is a speech-language pathologist? I think, we've all heard that term, but what exactly is it that you guys do?
Sure. So a speech-language pathologist is someone who is trained to both assess and treat communication and swallowing disorders. We can be found in a variety of places like private practices, hospitals, outpatient centers, schools, and rehabilitation centers.
Great. And then how does one become a speech-language pathologist? What sort of training is involved?
It starts with an undergraduate degree in communication disorders or speech and hearing science, but it doesn't have to be. Your undergraduate degree can be in anything, and you can make up that coursework through your graduate time. Then you go on to graduate school. Our graduate school program takes about 2 years. You have to have 375 clinical hours during that time. When you're done, you have to pass a speech praxis exam. And then you do a clinical fellow position. That position is typically a 9-month position so that it can fit within a school year if you're a school speech language pathologist. During that 9 months, you have to do a minimum of 1,260 contact hours, and that helps you gain your certificate of clinical competence and then your licensure. And then to keep those, you have to do continuing ed hours to keep your certificate of clinical competence, 30 CEU hours every 3 years, and to keep your Ohio licensure, 20 CEU hours every 2 years.
Yeah, so it's a lot of work and training to get where you are, and then it continues to be a lot of work as you continue to practice and keep up to date with everything, right?
Yes, correct.
Yeah. And then what services do you end up providing for patients and families in the clinical space? So what kind of things do you help families with specifically?
So as speech language pathologists, we evaluate and treat a variety of things. We treat speech or articulation, which is the actual motor aspect where you're producing the sounds with your tongue and teeth and lips and helps you to be understood when you talk. We treat receptive and expressive language. So receptive language is what you can understand. Expressive language is what you can express to other people. We treat fluency or stuttering. We treat pragmatics or social language, voice and resonance, dysphagia, which is feeding and swallowing disorders. And then these speech and language disorders could be the result of many other things. They could be tied with autism, cerebral palsy, hearing loss, traumatic brain injury, CVA, and other neurogenic disorders. Other specialty areas include apraxia, auditory processing disorder, dyslexia, selective mutism, and myofunctional disorders, which have to do with tongue thrust, where we work very closely with dentists and orthodontists. And then, of course, something that we're going to talk about more in depth today, we provide assessment and treatment in the area of augmentative and alternative communication, which is known as AAC.
Yeah. And that's going to be particularly helpful for kids and families that are impacted by complex communication needs. And so that is what we titled today's program. So I think it would be helpful to understand exactly what we mean when a child or teen has complex communication needs. Jamie, can you answer that?
Yeah, absolutely. So when we say complex communication needs, we're really meaning that child or teen is unable to meet their daily communication needs with their verbal speech. It means that essentially they're unable to express their daily wants, needs, thoughts, and opinions to their family, community members, or other peers at school. We typically reserve this term for individuals with the most severe speech and language impairments. So that's typically what we mean when we say someone has complex communication needs.
Yeah. And this really, it can be very different from one kid to another, right? I mean, there's no one size fits all for what constitutes a complex communication need.
Absolutely. There's a very big spectrum. Some children may have more skills than others, but it's definitely something to consider, like what all skills a child brings to the table and what things they are able to do with you. But essentially, we still use that term complex communication needs for any child who's not verbally speaking.
And then in addition to verbal speech, there are other ways that we can communicate, and sometimes those alternate ways can also be impacted impacted, which makes it even more difficult. And just as an example, I mean, if someone can't talk, they may be able to write. But if they don't have motor activity of their arms or able to do so in a meaningful way, then that's not really going to help them either. And so as we think about complex communication needs, it's not just verbal, but also often there are other forms of natural communication like gestures, writing, even sign language may be interfered with.
Absolutely, yes. If there's some motor impairments going on, it can be difficult for children to create different gestures or things like that, which makes it even more complicated.
Yeah. And when we think about our nonverbal communication, I mean, that's a big part of it, right? I mean, even facial expressions and gestures that we make and vocalizations and body language, where your eyes, if you're making eye contact or not. And so all of these other forms of communication, the more of them that are impacted, the more difficult it is for a child to communicate.
Absolutely.
Yeah. And then what are some causes from a medical disease standpoint that results in complex communication needs? What sort of disease processes are we looking at?
Sure. So when we think about causes of complex communication needs, there are typically three main kind of categories that we think about. So the first would be developmental disabilities. So any child who has a severe intellectual disability, something like cerebral palsy, autism, or apraxia of speech, those are conditions that those children will be born with. And we know usually from a very young age that those children may require some sort of AAC technology to intervene. We also work with children with acquired disabilities. Sometimes later in life, a child may have a traumatic brain injury or a stroke, for example, and that may result in an inability to communicate that requires the introduction of AAC technologies. There may be things like tumors or trauma to the structures that we need to produce speech that may also result in a need for AAC. And then the third category that sometimes gets forgotten is temporary conditions. So sometimes post-surgical procedures or different side effects of medications or intubation can also prevent a child from being able to speak even for a short amount of time. So then we can also think about using some AAC strategies to help.
So, we've talked about AAC in relation to complex communication needs, and that stands for augmentative and alternative communication. When we use that phrase, Bridgett, what exactly is it that we're talking about?
So when we speak about alternative communication is used when a person is unable to produce verbal language or they have very limited verbal language. Augmentative communication is when maybe that person has verbal language, but it's very difficult to understand or it's unintelligible for some reason. Some forms of AAC use external equipment and some don't. So we have unaided strategies that don't require that external equipment. And that's what you were talking about earlier: gestures, sign language, vocalizations, body movement, directing eye gaze. So some of those are available to our patients, but our patients with motor impairments, sometimes those are not options. Also, if you think about our patients with social language impairments, like children with autism, using directed eye gaze is one of the hallmarks of a deficit with a child with autism. They don't necessarily have that skill, so they're not going to be able to use it to communicate. Aided strategies that do require external equipment can be low tech or high tech. Low tech equipment could include things like communication boards, so where you've printed out a board of icons and laminated it. Could be photos or pictures. The Picture Exchange Communication System, otherwise known as PECS, is a very popular low tech system used with children with autism and other disorders. It can be high tech equipment, and that can be anything from switches or buttons that when you press it, it produces some voice output, a single word or a sentence. It can be iPads with speech generating apps on them, or it can be a dedicated AAC device with synthesized speech output.
Great. And as in my research for this particular episode, I came across that there are over 2 million people in the United States who use some form of AAC, augmentative and alternative communication. And I would imagine that over time, as we've become more technologically advanced, that the forms of AAC devices have likely changed, right?
Definitely.
Yeah. So the more high tech devices, what are we looking at now in terms of what's available?
So, an AAC device in general, now when we talk about the high tech, they're voice output devices. They usually use an iOS or Windows platform with a special software program, and they can produce speech output at various levels. And then they are set up in a very organized way. So there are several different software programs that use different organizational systems, and that's one of the things we are feature matching with a child when we are assessing. And then some of our children who don't have as major motor impairments can access the device via a touch screen. They might use their hand, but they might use another body part like their toe. But some of our children cannot access it directly like that. So another way that current AAC devices can be accessed is using eye gaze. And so these devices have infrared cameras that can track eye movements and allow children to control a device with their eyes. And throughout the years, that eye gaze technology has greatly improved. Children with all sorts of visual issues, from cortical vision impairment to needing to wear glasses, can still manage to access a device with their eyes due to the improvements in technology. Other ways that technology allows them to access devices is through switch scanning. So they can use one of those buttons or switches, and they can hit the button and it will start the cursor moving on the screen. And then they can again hit the button to stop it to activate the word that they want to activate. And they can be activating that switch with their head, with their foot. But there's very high technology switches. So if a patient doesn't have any head movement or foot movement, there's, sip and breathe ones. Jamie, what are those called?
Sip and puff, a sip and puff switch, I'm pretty sure.
Sip, yep. Sip and puff switches, where you can activate a switch by having it in your mouth, and just by blowing into it or doing a certain type of inhale or exhale, you can make it move the cursor on the screen. So the technology out there is fantastic. There are options for people with very limited movement. So everybody should have that ability to communicate regardless of their restricted motor skills.
Yeah. It really struck me just how many different devices are out there. And in the show notes, I'm going to put a link to an article that just has some examples so that you can actually see and read more about. But this can really range from, as you said, you push a button and a spoken word is said through a speaker, versus actually typing words on a screen that someone can look at. And it can also range from just having icons with pictures, and you touch a picture to get a point across, versus having an alphabet, which then is going to require more literacy and being able to spell. And so, more advanced skills are needed to work that sort of device, but you may be able to get your point across with more nuance, by using language rather than just one-to-one pictures trying to describe what you're trying to say. So I would imagine that even during the course of a child's life with complex communication needs, that the type of system that they're using may grow with them, right?
Absolutely. It definitely can change over time. And I think one of the things we look for when we are pairing children with the devices and language systems is the ability to have that system grow with them over time.
Yeah. Now, how about just so some of these devices are independent machines that someone has that take along with them, but everybody, for the most part nowadays, has a smartphone in their pocket. Are there apps for like iOS and Android that can help with complex communication needs that someone could just put on their phone?
iOS tends to have more options than Android. Android hasn't quite caught up to the iOS options. Um, but there definitely are a variety of options, and that's how some families start out. Is they download an app and they try it at home because there are free versions and light versions. So there are definitely a variety out there. You have to be careful if you're on an iPad instead of a dedicated device. If you're using an iPad or a phone, there are some limitations to that, where you don't have amplified sound in speakers. You don't have the built-in durability. I can't tell you how many kids manage to crack the screens on their iPads and smartphones, because these kids often have behavioral things along with their other impairments. And so first thing that goes when they get mad is they chuck that device. But some of the more dedicated devices that you can get through insurance funding as durable medical equipment, one of the device vendors, in their notes, they used to talk about how they had tossed the device in the washing machine and ran the cycle, and the special glass that they use and things like that could withstand being in that type of situation. So there's definitely apps for your smartphone and your iPad, and they're a great start. But if it's something you need to use long term, a family's definitely going to get durable medical equipment.
Yeah. From a speech language pathologist standpoint, you guys really have a good grasp on all the options. And as you take an individual patient and family's needs into account, you're going to be able to direct them to the most appropriate device for their situation, right?
Yes, that's correct. Families can get connected with AAC technology through Nationwide Children's or through other settings. So at most medical settings, they would need to have their doctor send over a referral. Ideally, that referral would say AAC Evaluate and Treat. And then they can do it through their school sometimes. The school helps set them up with systems, or like we talked about, they can start to try softwares and things at home on their iPad. But there's a lot of training that goes into making sure we fit you with the right device. So it's an extensive process. When you come in, for example, at Nationwide Children's, you have to have at least 3 months of trials with a particular or with devices in general, and try at least 3 different softwares or devices so that we can make sure we get the right fit. Because again, if your insurance pays for it, you're only going to get a new one every 5 to 7 years as that piece of durable medical equipment. So we have to make sure we pick the right one. And then we have to make sure that system can grow with you and your child as they grow through the years.
Yeah. And I would imagine that it's important not only to teach the child how to use the equipment, but also the whole family, so that they can also be on the receptive end of communicating and also helping the child if they're having difficulty with it.
Do you want to take that one, Jamie?
Sure. So yeah, we do a lot of parent training. It's very important for us to work with the families and have a lot of buy-in from them in terms of wanting to use the device at home, in the community, and at school. We also work with a lot of teachers and school speech language pathologists to make sure that we have good carryover between what we're doing in our therapy sessions, as well as what's going on in school and classrooms for that child. So there's definitely a lot of training that goes into this, and the parents are one of our biggest resources in terms of making sure that that device is being used and pulled out at home, and giving that child as many opportunities as we can to use that device.
Yeah, that definitely makes sense. As you work with patients and families with AAC devices, how have you seen, Jamie, the impact that these devices have on the child and the family? Like in particular, before they were introduced to them, and then once they get trained and they're using it, do you see a big difference in the life of the kid and the family?
Yes, absolutely. We definitely see big differences for many children. Really, AAC opens a lot of doors in terms of being able to express themselves and connect with their family, friends, and community members. We all know that it's really important to engage socially with others, just to build relationships, make friends, and participate in an active role in society. So AAC devices really give that opportunity to a lot of children with complex communication needs. I personally feel like these devices provide individuals with a lot of autonomy, so they're able to make decisions about things in their daily life. And then later on the road, it also opens up doors for like vocational opportunities as well, and just offers a lot of independence in daily activities for these children, so that they're able to express their needs if they want something particular to eat, or if they want to watch a particular movie, or if they want to tell their mother that they love them. This is really one of the ways that a lot of children are able to express themselves. So it can make a huge impact on the lives of these children and their families.
Yeah. And as we think about the difficulties that these kids have to face anyway, and the barriers to quality of life, I mean, being able to communicate and get your needs met and participate really in the family and with the extended family and community, it just really increases your quality of life.
Absolutely. Yeah, it makes a huge difference.
I think it's also important to note, not only is there those benefits that are right there in our heads of, oh, we've given them a way to communicate, but what the research has found is that AAC actually helps promote verbal speech. So sometimes what ends up happening is the child might be completely nonverbal. We get an AAC device and we start working with them and they start to become verbal. The AAC device has many benefits to it. One of the things that helps promote verbal speech is that when an AAC uses synthesized speech, it produces a word or a sentence the exact same way every single time. And that can be easier for a child with a disability to imitate. There's not changes in pitch. There's not changes in, Jamie and I might say one word and we might say it completely different based on our dialect or where we were raised. But the AAC device is going to say it in the same way every single time. And so quite often, children will be able to imitate that more easily than they can imitate a regular human voice. I've had kids that their first words were system armed because they were imitating their security system at home, but it's that computer modulated voice. Another way that AAC helps them develop verbal speech, it's a constant visual cue. So there's always that visual cue in front of them helping aid the cognitive process of it. Also, sometimes what happens, we tend to think receptive language comes first. I have to understand something before I can say something. And actually, that's not true. So sometimes the act of saying it and using it, children then start to understand the effects of it of, oh, when I hit this button, cookie, 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 I'm getting a cookie. And that can help me understand it long before my ability to pick out a picture of a cookie. So there are lots of ways that help. It also takes the pressure off. So disorders like apraxia, where the muscles are fine, there's that ability to produce speech, but when the brain tries to tell the mouth what to do, the signals get crossed and the motor movements end up jumbled. When you take pressure off of a child with apraxia, it's a lot easier to produce speech. So you will see these kids with devices, they'll be finding their word on their device. They will say it verbally as they're looking for it because the device has taken off the pressure and it's made it that much easier for them to communicate verbally. So besides that added benefit of, the main purpose of AAC is to give them a way to communicate, we've also put this device in front of them that's going to help improve verbal speech, which is always our long-term goal. Verbal speech is the most efficient means. So families get nervous about that, like, oh, we're getting a device, you're giving up on him talking. And that's not the case. We're hoping that this device is going to help them talk if there is that physical capability.
Yeah, that's a really good point. That this is for some people, who have had a stroke or they have other neuromuscular diseases where they're not able to talk, and the prognosis for that is not very good. For those kids, this may be a permanent solution, but there are plenty of other kids out there that this is just a bridge to help them communicate until they are able to imitate and do that on their own effectively. It's a really good thing to keep in mind. I would imagine, Jamie, that with the increase in technology and hopefully the costs coming down a little bit, that there's really more of a widespread availability of this kind of technology for kids. Would you say that that's true?
Yes, absolutely. We are seeing a lot of parents who actually now are bringing devices to us with different programs already loaded onto them because they are so much more accessible. So we have, seen that happen a lot more frequently because they are so much more available. The internet has definitely resulted in parents being able to search and find different devices and purchase them on their own, and then kind of bring them to us and say, like, is this working? How can I do this at home? So it's kind of changed the way we work a little bit.
Yeah, absolutely. And again, with just the availability of technology and just the different options that are available, we're also increasing awareness about this, which may help to bring more families, into the fold of using them. That's certainly possible as well. What do you think happens when a child that has more challenges to resources needs one of these devices? Is this something that Medicaid will cover? And I know you'd said from a durable medical standpoint that you only get one every 5 to 7 years. Do all insurance companies typically cover these? Do you ever have to sort of advocate for kids to get them covered?
And Bridgett, do you want to take that one?
That's a loaded question.
Yeah.
Typically, so no, not all insurances cover them. Typically, Medicaid is very good about covering them. We do need the doctor to sign off on the CME to say that they agree and they want the child to have the device. But private insurances can be sticky about it. Sometimes we do have to do an appeals process. So we might write the request and send it in, and the insurance denies, and then we appeal. And the insurance might deny again, and we appeal. And then the final step is we go to court. And I have had to do that where, you go to court and you basically state why the child has to have this communication device. And it's tricky because when insurance companies are reviewing this, and say, for example, you do a peer-to-peer review, it's often not a peer-to-peer. It's a doctor or nurse and a speech language pathologist. And so that doctor or nurse who's making this decision might not have the knowledge base to effectively make it. So we are often quite successful getting the appeals approved and things like that. And then if ultimately we don't get it, there are other ways to secure a device. So there are lots of grants out there that patients can apply for to help get funding for devices. School systems can sometimes fund the devices to make sure they're successful in their education. The only issue with that is sometimes it's limited to school. So they might not be allowed to take the device home, or they might not be allowed to have it over the summer, or when they graduate, they can't take that device with them. So there are some hindrances there. Or we look at options like, okay, we can't get the dedicated device. Can we at least get an iPad with the app? It might not be as durable. It might not be a long-term great option, but it's better than nothing. So there are all sorts of workarounds, but Medicaid is definitely one that almost always will cover it. Sometimes they're picky about which vendor they want, which is a whole nother can of worms. But definitely we can get that coverage.
Yeah. So it's good that you can get that coverage. It also sounds like it's probably a pretty frustrating part of your job. Like if a speech language pathologist says a kid needs it, like why can't we just get it for the kid because they need it?
Exactly. And we understand it's expensive technology when you're talking about infrared cameras and durable, the durable glass and things that they use. I mean, these devices can be upwards of $20,000. Not all of them. Some of them are more in that $3,000 to $5,000 range, but it can get expensive. So you understand that insurance companies are protecting their funds. But when a child can't communicate, for us as speech language pathologists, that's, it just blows our mind that they would ever refuse it. But yeah, it can be a frustrating experience, but ultimately very rewarding once we get that device in their hands.
Yeah. And then just to see that kid come alive once they learn how to use it and are doing that on a regular basis, and then engaging with their family and their communities, I totally see how that would be so rewarding. Let's talk some specific devices, because it's really, as I was researching this episode, I really came across a lot. There's so many of them out there, so many options, and you can see how they can be customized to a particular child's needs very well. So, Jamie, if you could just give us some examples of the hardware that's available. And again, I'll put a link in the show notes to it's an article called "The Top 10 Augmentative and Alternative Communication Devices," which, whether it's really a top 10 or not, I don't know. It's someone's idea of a top 10, but at least there are 10 that are pretty commonly used that folks can check out. But what are some of your favorites?
So that's a great question. There's definitely a huge range of devices. So we do use iPads quite frequently, but in terms of like the actual vendors that we go through, a lot of times there are some major players in the field. One of which is Tobii Dynavox. It's an international company. They have a lot of different devices, and one of their specialties are their eye gaze devices. So we have things like the i110, the i13s. We also have another company called the Print Key Romit Company, PRC. It's actually based out of Ohio, and they also have devices like the Accent 1000, things like that, where we can have children who are direct selecting. They also have eye gaze devices as well, so some larger devices with the infrared cameras that can pick up for eye gaze. And then we have so many applications that run on iPads as well. Another thing to mention is, along with our AAC technologies, we have a lot of switches. So like Bridgett was saying as well, we have Bluetooth switches, the sip and puff switches and things like that. all of these can be added to a device to help make them more accessible to someone, especially if they have some sort of physical impairment that just restricts their ability to directly interact with that device. So we have quite a range of different accessories and things like that that can be attached to these devices to make them work for a child.
So it's really important for families to get connected with a speech language pathologist when their child has complex communication needs. Here in Central Ohio, that's an easy enough thing to do. And I'm going to put a link to speech pathology at Nationwide Children's Hospital so folks can find you easily. But really, it's through the primary care doctor that you would get a referral to see a speech language pathologist. And so as a parent, you may have to advocate for that referral to take place. But at the end of the day, that's really going to be helpful for you and your family. But let's say for folks who are not in Central Ohio, we have a lot of listeners all across the country. What's the best way to get in touch with a speech language pathologist in other parts of the U.S.?
We can have them access our professional site. So the American Speech Language Hearing Association, which is otherwise known as ASHA, ASHA, www.asha.org. They have a Find a Professional search on there where you could go in and put in your city and state, and they will help you find a resource. A lot of vendor companies. So if you search AAC and you find a vendor company, they have ways to locate speech language pathologists to trial their systems. Your doctor in any organization, a lot of times they will know how to hook you up with a speech language pathologist. They might not right away find the speech language pathologist that specializes in AAC, but speech language pathologists as a whole, once you get to one, will help you find one that has that experience level as well.
Yeah, that's a really good point, that your first contact with a speech language pathologist may not be one who is specialized in complex communication needs, but they're going to know colleagues that, are interested in that and what resources are available in a particular community, for sure. I would imagine that the training, as the devices get more technical, and especially like the eye gaze devices, I suspect that that's difficult in terms of training kids how to use that. What sort of roadblocks do you run up against, Bridgett, in terms of the training process?
Well, the most important thing to note for the children themselves, that there's no prerequisite skills for starting to use an AAC device. So sometimes clinicians or doctors will hold off. Oh, well, he can't even do joint attention, or he's not pointing to any pictures. None of that matters when we start AAC. Like we talked about, sometimes they need that device to learn those skills. So there's no prerequisites for the child. We're going to put that device in front of them from day one if we recognize there's a need, and we're going to start to work through the difficulties. And then as they go, we adjust things like positioning and access methods. And now on the flip side, for the clinician, there's quite a bit of training that's needed. We have to do lots of hands-on practice. We have to have training in all the various softwares and hardwares, lots of coursework. And then we have to know about positioning. We have to know about assistive tech in general, because these days the technology for AAC devices isn't just limited to communication. These devices have the ability to control your TV remote if you need it, or to access Alexa. So you have to know about AT or assistive tech in general. At NCH, we actually have 3 levels of competency that our therapists have to go through at the different stages. So, to treat different types of AAC patients. So, and that involves a literature review, observations, hands-on training, video modules, external trainings. And then you think about the parents. What level of training do they need? They're going to get some training in therapy with us. Many of the vendors of AAC devices provide free trainings. Those can be in person or online. Vendors and their representatives will go out to school systems to help train the school staff on the systems. And these days, YouTube is a great resource. A lot of vendors have YouTube videos out there about how to use devices, how to troubleshoot things, and you can watch a YouTube video on it. So there's definitely lots of resources out there for training the parents and the clinicians, but just know that child, they don't need any skills to start with. We are going to provide them those skills.
Yeah, very, very good to know. And that provides so much hope, I'm sure, for these families to hear someone say, look, there's no prerequisite skills. We're going to teach your kiddo how to do this, and it's going to improve your family. It may be a rocky road a little bit, and there's a little bit of an uphill challenge, but we're going to get there. And I think just those positive words of encouragement right out of the gate, I'm sure is a very helpful thing for families to hear. As we think about how technology has really improved AAC devices and availability and has brought costs down to some degree, what does the future look like, Jamie, for AAC technology? What do we have to look forward to, you think?
I definitely think we have to look forward to a lot of refinement of our current technologies. So there are updates that are rolling out from our vendors almost on a monthly basis where they're making changes to the software programs that we're using. They're introducing new features, like Bridgett said, a lot of things for like environmental controls, internet access, being able to play with video games is now something that children are able to do through their AAC devices, which can be very motivating for children. So I think we're going to be continually adding new features to help support individuals who use AAC, help them to access their school curriculum and things like that, which is really important. I also think that we'll likely have even more individuals who are using AAC. I think it's becoming more common to introduce it earlier to children, which is something that we really like to see kids get started from an early age, especially if we know they have some limitations in their communication skills. We want to introduce it as early as possible. So I think more and more clinicians are getting on board earlier with AAC. And I hope that as our future progresses, we continue to introduce these to children earlier. I also think there's going to be a lot more acceptance of AAC in the schools and communities. I think more as we see more children with devices for different purposes, that it's becoming more acceptable to walk around with an AAC device. I think that it's not as big of a stigma associated to having an external device with you to communicate. So I think that overall, I think we can start to see more individuals with complex communication needs working in the community, or at least being out in the, in society and having different roles than they maybe have had before. And then I also think we are continuing to do some more research. There is plenty of research going on in this field specifically on lots of different things. Some new and exciting things that I'm particularly interested in are new access methods. Like we have a lot of research going on now on brain-computer interfaces, where individuals with the most severe physical impairments are actually able to control some of the devices with a switch that is activated by their brain. And I think we have lots of advancements to make in terms of eye gaze and different access methods that can really increase the access to these devices to help people communicate.
One of the other exciting changes is kind of on the flip side, not so much the technology, but in regards to diversity and inclusion. The AAC technology and device and software companies have really put a big effort in the last few years. It used to be when you were choosing your icons, the little figures that might be in them, you had a choice of two skin colors. And they have come out now where these your icons can be in a whole shade of skin colors, a whole gamut of different options to personalize it to your ethnicity or your status in life, and make them really reflect you. And it used to be very tedious to change those things. I would have to change each individual button. They've come up with these software programs where you can click a button and change every person icon in there to have a different skin tone or different shade. So they're trying to make it be a more diverse reflection of the people that are using these devices, as well as being available in multiple languages as well.
Yeah, very, very helpful for folks, for sure. Bridgett, you'd mentioned research, or we have mentioned research in terms of the speech language pathology in general. But we really have speech and language pathology clinical research at Nationwide Children's, right?
We do. And Jamie actually helped drive most of that research. So I'm going to let Jamie respond with some of the research that's going on.
Yeah, absolutely. So we have several research studies going on right now specific to AAC technologies. So, for example, one of the projects that we're working on right now is trying to increase participation between children who use AAC in interactions with their peers. So we're doing some arts-based activities where those children are interacting with each other and learning how to use their AAC device to talk to someone who is their own age. And it's like a really nice study to just kind of help with those kids interacting with each other. And then as well, along with that study is also an online training program that some clinicians have gone through to learn how to better support children who use AAC as well. So we definitely have some research projects in the works and things that are coming out frequently just to continue to add to the literature on this topic.
Yeah, that's great. And then Bridgett, we'll wrap up with you. Just give us a summary again of the services that you guys provide, speech pathology at Nationwide Children's Hospital. We'll put a link in the show notes to the services that you guys do provide to families and also to some of the research that's going on. But just give us that nutshell of what you guys do.
Sure. So speech language pathology here at Nationwide, we're part of the clinical therapies program. We're a robust and growing program with over 100 speech language pathologists, and we're going through a significant growth plan for the next 5 years where we're going to grow in staff numbers and locations that we provide our services. We provide services in the outpatient settings, either at the main hospital or in our close to home settings. You'll also find us in the NICU, acute care, inpatient, home care, the behavioral health pavilion, and a variety of clinics like the cerebral palsy clinic, early developmental clinic, the child development clinic. We're going to be involved in patient care, so individual and group programs. We do research, payer training, community outreach, university trainings and teachings, telehealth. And again, those areas that we are treating tend to be speech and language, so the motor aspect, and then the language aspect, feeding and swallowing disorders, stuttering, voice and resonance. And then we treat children with complex communication needs and use AAC or alternative and augmentative communication.
So really helping lots of families and kids in so many ways. And again, I'll put a link in the show notes so folks can find out how to connect with you easily. Although going through your primary care provider is probably the easiest route for families to get in touch with you. And then you had mentioned the American Speech Language Hearing Association website. So folks who are not in Central Ohio, you may get some ideas on connecting with a speech language pathologist through their website. And we'll put a link to that in the show notes as well. So once again, Dr. Jamie Boster and Bridgett Collins with Speech Language Pathology at Nationwide Children's Hospital. Thank you both so much for talking with us today.
Thanks for having us.
Thank you.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast CME a part of it. I really do appreciate that. Thanks again to our guests this week, Dr. Jamie Boster and Bridgett Collins, both speech language pathologists at Nationwide Children's Hospital. Don't forget, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCastCME.org. You'll find our entire archive of past programs there, along with show notes, CME information, our terms of use agreement, and that contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show, and we love connecting with you on social media. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. So you've listened to the podcast, and now be sure to claim your free Category 1 continuing medical education credit. It's an easy thing to do. Simply head over to the show notes for this episode, 77, at PediaCastCME.org. You'll find a link to the post-test in the show notes. Follow that link to Cloud CME, take and pass the post-test, and the Category 1 credit is yours. Super easy, right? And again, we offer credit to many pediatric professionals, including doctors, nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. Of course, you want to be sure the content of the episode matches your scope of practice, which for this one would really be everyone, because we all need to communicate with our patients. Complete details for the credit are available at PediaCastCME.org. And then also don't forget about Plain PediaCast. That is our evidence-based podcast for moms and dads. Lots of pediatricians and other providers also tune in as we cover pediatric news, answer listener questions, and interview pediatric and parenting experts. Shows are available at the landing site for that program, PediaCast.org. Also available wherever podcasts are found. Simply search for PediaCast. Thanks again for stopping by, and until next time, This is Dr. Mike saying stay informed, keep it evidence-based, and take care of those kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast CME.